As COVID-19 case counts continue to drop in our region, local health leaders say we're not out of the woods yet. As of Friday, the number of active COVID-19 cases in Northeast Tennessee was down to 126. That's the lowest number since July 1st of last year. 91 new cases had been reported in Northeast Tennessee in the previous 7 days before Friday. So a lot of reason for good news here. We're bringing in Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, you've been with us through it all. It's good to see you again. Thank you so much. First off, your reaction to where we are. I know we're looking at some new numbers coming out this week from Ballad, but based on what you're seeing tonight, how are you feeling about all this?
You know, right now, obviously, the region is in a fairly good place as far as cases and new cases. You know, our numbers look much better. We are certainly far better than we were just a few months ago at this time. So the data around new cases and all of that looks really good right now. Okay.
With that said, I know you are, and really the planet is closely watching the Delta variant. And as it emerges in Europe and now is becoming a concern here, how concerned are you about this variant to COVID-19 that appears to be extremely highly transmissible?
Yeah, there are various and many concerning things about the Delta variant. So it's really important for people to understand that this variant is more contagious and significantly more contagious from everything that we're seeing. And so that really becomes a risk to those in our region who are not vaccinated. So up to this point, I think we've had people who have not become infected, who felt like maybe they weren't at high risk, that COVID probably wouldn't affect them. And what I'm concerned about is if the Delta variant gets here, and it probably is when the Delta variant gets here and not if, those people are the ones that are going to be affected. We know that it's those unvaccinated people, or even the people with only one vaccine of the 2-dose series, that are really going to be at risk. And so I don't want those people living under a false sense of security, because their risk is going to greatly increase when the Delta variant gets here.
Is it accurate to say that the Delta variant isn't necessarily a more dangerous variant of COVID-19? Its impact is the same, but it's more easily transmitted. Is that accurate?
That's still up for debate. So it appears that it may also be more virulent, making people sicker, putting more people in the hospital. We're obviously watching that very closely. We know it's more transmissible. There's early indication that it's also going to be more virulent.
No indication that it's already here. Of your 30-some patients that we know from last week's numbers, you were at around 33 in your census. No indication that you have any of the variant in your hospital getting treatment?
Correct. It's really hard. So many of our samples across the state are just not genotyped, and so it's going to take a while. You know, I'm really focusing on what's happening around us. So we know that there are several clusters of the Delta variant in Memphis. That's fairly close to us. So I'm keeping an eye, and we may know in numbers before we actually have a confirmed sequence, just because so few of those samples actually get sequenced.
Do all signs point to the vaccine being effective against the Delta variant?
Yes, everything we're seeing is that if you're fully vaccinated, so that 2-dose series, if it's a 2-dose series, then you do have good protection against the Delta variant. And so an important point here is, you know, we talked about the 1 dose of the 2-dose series provided pretty good protection against that UK variant, the one that's really circulating right now. That is not the case with the Delta variant. They're seeing very high infection rates in people with just that 1 dose of the 2-dose series. So if you've gotten your 1 dose and you've not finished, now is really the time to go get that 2nd dose, or go start your series if you've not started.
Jamie, I think it's safe to say, based on everything I'm reading from health experts like you and nationwide, that, you know, we're at a point where those who want the vaccine have gotten the vaccine. And we're now really at that hard place where I don't know what. It's about convincing people. It's about increasing access. What do you personally think, from your perspective with Ballad, where are we right now? What's the battleground, and what's got to happen to get that vaccination rate above what it is?
Yeah, so we reached that point that demand has really gone down in our region. We're seeing that in our sites. We're hearing that from our partners. And so that's really part of our push right now, is to sound the alarm to those people. You may have been fine all the way up through this. Your risk is going to increase with the Delta variant. I really don't want to see one more case, one more preventable case, or one more death. And so the key to not letting Delta really have an impact on this region is certainly to get as many people vaccinated as we can before it gets here.
And quickly, as we get ready to think about going back to school next month, that 12 and up eligibility, do you see that being key as much as before?
Absolutely. We've had very low uptake in that age range, so I really encourage parents, especially with the Delta variant coming, now is the time. Go ahead and get those kids vaccinated that are eligible before they go back to school.
Jamie Swift with Ballot Health. Thank you very much as always. We appreciate your help.
Thanks.
Sarah?